Hi, everyone. Welcome. My name is Kambiz Ranavardi. I'm co-president of ColumbiaDC and a graduate of the School of Engineering and Applied Science. I would like to thank our partners first at the Harvard Club of Washington, D.C. and their members for joining us in this gathering. We are very honored to have Director General of the new Taipei City, Chingyu Yao, with us this evening, joining in from Taiwan early in the morning. Good morning. We are also fortunate to have NBC News Director of International Affairs and ColumbiaDC Co-President Natasha Lebedeva as our host. Please allow me to quickly introduce our speakers. I would like to encourage everyone to check our website for their full bio and detailed list of their storied accomplishment. Chingyu Yao is the Director General of the Secretariat of New Taipei City Government. She has been internationally recognized for a pivotal role in promoting Sustainable Development Goals, or SDGs, at the local level and sharing the city's experience in combating COVID-19 with the rest of the world. From 2013 to 2018, Ms. Yao was the principal advisor to the Taipei City Mayor on International and Cross-Strait Affairs, also acting as the Executive Secretary to the Taipei City International Affairs Advisory Council and Mainland Affairs Council. Ms. Yao has a master's degree from the School of International Public Affairs from Columbia University in 2003. Our host, Natasha Lebedeva, is the Director of International Affairs at NBC News. She is a graduate of Columbia University School of Journalism. Ms. Lebedeva is a recipient of several Emmy Awards, International Press Club Award, National Headliner Award, Alfred Dupont Columbia Award, and Columbia University School of Journalism's 2020 Alumni Award. So Natasha, sending this on to you.
Hi, hello everybody. Thank you so much for joining us tonight and in the morning in Taiwan for Ching-Yu. And thank you so much, Ching-Yu, for joining us. We're so honored to have such a high-ranking official for this amazing webinar. And we have a lot to talk about, and we're all looking forward to hearing your thoughts and sharing your experience with us. Just for the beginning, you have this very fancy title of and I just wanted to briefly ask what exactly is your role in the new Taipei government is, just sort of briefly to understand where you will be standing when we'll talk about Taiwan and new Taipei.
Good evening to everyone in DC or somewhere in the US. And good morning to people who are in Taiwan. So I'm now currently serving as the Director General of New Taipei City. Director General of the Secretariat, my job covers two very different areas. One is international affairs, and that's why I'm reaching out to many of the city partners and community during the pandemics, including donation and webinars and information exchanges. But another larger part of my work is to handling logistic support of the whole City Hall buildings, including the squares and our 32-floor high building. So all the policy implemented during the pandemic, including any policies in an enclosed space, I need to enforce it. So that's even including handling, giving out masks to our employees working in this building. So those are the two very different jobs.
Of course, I think you mentioned in one of our conversations that New Taipei City is like a mini Taiwan. So, from that perspective, we all probably heard that Taiwan was highly praised for its highly effective response to COVID-19. With the population of 24 million people almost, Taiwan had approximately like around 450 cases of COVID and only around 7 deaths. while originally, I think experts and analysts were very concerned about Taiwan because of its proximity to mainland China. It's about, I believe, only 130 kilometers away. And they were speculating that, it will be very hard hit by COVID-19, and especially because I believe it was about 840,000 Taiwanese are working in mainland China and traveling constantly every day back and forth. There were even scientific research and models done that projected that Taiwan will be the second region, mostly like the second highest risk of importation of virus region. And nothing like that happened, as it turned out. And Taiwan stands as an example of how governments can handle big pandemics. A lot of the success was attributed to early response and also to the fact that Taiwan was really hard hit during the 2003 SARS epidemic. And I'm sure you will be able to explain to us what exactly did Taiwan and New Taipei City and you learned from your experience into 2003 that you translated into the current handling of the pandemic.
Thank you, Natasha. So I think I will talk very briefly about how's Taiwan doing. And then maybe we'll talk about the lessons learned from SARS later on. I'll touch upon that. So just like Natasha said, we are so close to mainland China where the virus originated. And but so far, just like the number that Natasha has said, so far we have 475 confirmed cases and 7 deaths. And we have never experienced any lockdowns. Schools remained open, and markets, shops, restaurants, public transportations, business, parks, they are open as well. And a lot of events are still taking places. We even had some political protests and city mayor recall election during these pandemics. And for the past few weeks, we even see a surge in domestic tourism. So all these are telling you, yes, just like Natasha said, we're handling the pandemic surprisingly well. And why we're doing it so well, this part I may need to use a little bit more time to share it with all of you, how Taiwan has win so far, knock on the wood, so far against the virus. I think first and foremost, it is a race against time. So Taiwan has taken very, very early on proactive measures from very early on. So all of you know the first confirmed case in Wuhan is in December 31st last year. And the first case in Taiwan is within a month. It's in January 21st. So that's why everyone was quite pessimistic about if we will be able to handle the crisis well. So we started the screening of border controls very early on as well. Taiwan is an island. So the first thing is that we need to stop virus at the borders. So we started the tracking system also very early on. Home quarantine systems followed. That means anyone that wants to come into Taiwan need to fill up an online quarantine form. And that's the only the beginning. Then if you are from the high risk areas, that means you will be put into the system of our home quarantine system and tracked by mobile phones. Then, for example, our city governments and our village chiefs then will need to follow up with you to call you 3 times a day. And throughout the traveling and the journey from the airport to your quarantine hotels, you will be taking the transportation provided by quarantine fleets of taxis. So all this system, we started very early on. And We also set up the highest level of emergency command center as early as in January. And January is a key time in stopping the spread of the virus because in late January and early February, it's Chinese New Year holidays. And that's when people move around the islands. So all these measures that we started very early on. So we take very proactive measures. And these are just a few examples that I can give you in the interest of time. Second thing is all the policies that the government made is strictly science-based. So we have very sound science-based policy. For example, a lot of our policies that are based on 2-week rolling basis, and it's adjustable. But why 2 weeks? Because 2 weeks are the virus's incubation time. So this is one thing that you need to base your policy on science. Also, our policy, including a lot of restrictions policies, are also based on science. For example, for this virus, the death rates are very different in different age groups. So for senior care home, we have much more strict policy probably than the schools. So all our policy are flexible, adjustable, but very strictly based on science. And trust me, as working in the government, it's very difficult to turn sound science into policy. It takes a lot of debate. It takes a lot of balancing. It takes a lot of pros and cons discussion. But I think that's one rule, one principle we cannot give up, science-based policy. Thirdly, especially for local government, as I'm working in the largest city government in Taiwan, the government needs to take a wholesome approach. For example, I mentioned a little bit about our quarantine policy. And you know, this quarantine policy is severely and seriously restricted citizens' activities. So for implementing the quarantine policy, we have 5 different departments to work together. So some of the usual suspects you will know, for example, health department, home affairs department, police department. Why? Because if someone is not staying in where he should be quarantined, he's not staying at home, we need to activate the police search system. And we also include Environmental Protection Agency. Why is that? Because all these people who are staying at home, their garbage needs to be taken out daily. So for that, we have environmental service. We also have information department to come in to help. Why? For these people who are staying at home, we provide them with 14-day free trial of online streaming service. So simply put, that's a Taiwanese version of Netflix. So all this, we need to make sure their needs are being taken care of. And only in this wholesome approach, we can make sure all the policies are implementable. So we are issuing policies that inconvenience our systems and sometimes even hurt their business. So we need to make sure that all these services are also provided at the same time. And lastly, I think open communication is also very important because only through open communications, it's a trust building process. It will become a virtuous circle, not a vicious circle. I will use one example that is in January, we started a Wear a Mask campaign. I'm sure wearing mask or not is also a big debating issue in the US. But in New Taipei City and in Taiwan, we started Wear a Mask campaign in January. Of course, now we know it's very important and it's one of the key factors to stop the spread of the virus. But that's not what everyone thinks back in January. So to make sure everyone is wearing a mask, it's not just our city mayor starting wearing a mask in all the public appearance. He also did 3 things. First, for people who want to wear a mask, are they able to get access to buy a mask in a pharmacy. So first he visited a pharmacy, and from his first-hand experience, indeed, people started to stock up masks. And it's very difficult to purchase any mask in a regular pharmacy. That's the first thing. And second thing is he inspected a few mask production factory in New Taipei and make sure that, yes, indeed, these factories are running, but why those masks are not coming into the hands of our citizens who want to buy them. So the third thing is that he calls on the central government who set up the general COVID-19 policy that maybe we should start thinking about banning the export of masks. Two, we need to start rationing ourselves of the mask. And very good collaboration between the central government and city government is that the central government takes in all these advices. So I think our central government and local government are working in collaboration, but also has a healthy competition. The most important thing is citizens' awareness. So they support all this policy throughout the whole time. And we count on their support in the future as well, because we know it is not over yet.
And obviously, like from this amazing presentation, you know, it shows how efficient everything worked and how quick your response was. And coming back to the SARS lessons, do you think it's because my understanding is that after, you know, the experience with SARS and tragic events that happened, Taiwan established a central command center for handling the future, you know, possible epidemics and pandemics. And probably that's one of the reasons that since you were prepared already and in so many years, your response was so quick. And I believe that early January, you already sent several scientists to China, to Wuhan, to check what, you know, what's happening with the virus. And you would not rely on one source of information. And you actually took everything in your own hands, since you are not a member of the World Health Organization for political reasons, obviously. So basically, you took everything in your hands, Central Command Center. As you said, you used science. And I believe also that you used a lot of like big data, and your scientists were mapping out, you know, who got the virus from whom and where it's going, using like big data information. And I believe your Minister of Health, Mr. Chan, is a scientist, like a John Hopkins trained epidemiologist himself, which also probably helped the situation. So like from SARS and early response, what do you think were the most important things that other countries could have done, like the way you did it?
So indeed, during SARS, just to remind everyone, it's during 2003 to 2004. And in Taiwan, we had the highest mortality rate. So indeed, like Natasha said, we've learned the lesson the hard way. So it's 17 years ago. And a lot of the cabinet members and a lot of people like me working in the government are actually have experienced SARS. And that experience indeed helped us. And it helped our society to have a very high awareness and very alert and understand a lot of policy, even though inconvenience their life, but it's for the better protection for the whole society. So that's the first thing. And upon the system, because as you say, we've withdrawn from World Health Organization since 1971, and we've been an observer for a few years during 2009 to 2016, but we're not a member of the World Health Organization. So right after SARS, we have amended our very important act that is Communicable Disease Control Act. So the essence of this amendment is to put the alert system back into the hospitals. So all the hospitals, once they have a confirmed legal communicable disease confirmed case, they need to start preparing everything that they need to do without the government. They don't need to wait for the government. They don't need the government approval to give this information to the hospital system. So for example, I mentioned that our first case is in late January, but before January, when the world sees the first confirmed case in Wuhan, all the hospitals in Taiwan already started the preparation. They already check on each other and have already passed on the data and necessary information sharing. So that's the first thing we have established from the SARS. And second thing is that for the banning of exports of our mask, all these emergency actions are also implementable, are doable because of the amendment of this Communicable Disease Act. So the last thing that we learned from SARS is, even though we're not a part of World Health Organization, international partnership is more needed than ever. It doesn't matter if you are in the system or not. You need to collaborate with your international partners, because all the communicable disease knows no borders. So for example, Taiwan has established very good collaboration with your country. During the pandemic for the past few months, we have also signed bilateral partnership joint statement, including developing the possible vaccines, including exchanging information. And Taiwan also donated a lot of PPE to the US, and our city mayor also had a meeting with all the PPE company with your quasi-embassy in Taiwan. So all this is telling us international partnership is needed. It doesn't matter if you are in the WHO system or not.
Of course, completely understandable. I think one of the interesting topics will be, if you can touch upon briefly, is the way you, Taiwan and New Taipei City in particular, handled schools and universities, educational establishments, especially now when it's a huge debate in the US whether the schools should be reopened or not opened in the fall. As you mentioned in your presentation, Taiwan did not close any schools. I think you just extended Lunar year holiday by 2 weeks. And within these 2 weeks, I understand that you did special education of all levels of, on all levels of people involved in education. So would you touch upon like the way you handled it and the way it could be handled by other governments?
It is indeed a very difficult choice. It's a difficult balance between health and our society. And you can imagine, like if schools closed, that means parents, one of the parents need to stay home. And consequently, it will affect our society, especially economic activities, a lot. So it is indeed a very difficult choice. And our case and our decision may not be applicable to all the societies, but we're here to share our experience. So right after the Chinese New Year, schools supposed to be open in mid-February. In Taiwan, schools finally opened after 2 weeks delayed in late February. So what did we do during these 2 weeks? Because since the schools opened in late February until we had our summer vacation just 2 weeks ago, we have not seen any big communities outbreak at schools. So finally now I can say all these measures, control measures taken for campus, for schools are successful. So I'm really, really glad and grateful to share this experience with you. So the virus, we have guidelines in everything. So for reopening of the schools, the guidelines are you have 3 levels of protection. First is temperature measurement. Second is we have issue policies to make sure that the parents know when the schools will be closed and when not to let your children or let your come to school. So all this education, we have made it into online information package using those 2 weeks delay period to give it to parents, school teachers, and students themselves. So we have made a lot of interesting videos, including how to wash your hands, why should you wear a mask, why you cannot come to school if you have traveled somewhere else outside of Taiwan during the holidays. There are a lot of psychological policy and principle that we have embedded in the reopening guidelines, because of course we will issue a form to ask the parents, have you traveled outside of Taiwan during the Chinese New Year? Of course, the parents sometimes may not give the most actual response, but usually the children will. They will be happily tell the classmates, oh, we've traveled to here and there. Then the teacher would have the awareness to inform the health department and also the parents, your children should not be home. They should stay at home. So using the 2 weeks time, we make sure everyone know their positions. And this may be inconvenient, but it is important to follow these guidelines. And the last protection is that our policy is once there is a confirmed case in a school, we'll suspend the class. If there are 2 confirmed cases at school, we'll suspend that school. If there are more than 2, that means 3 and up, we'll close all the neighboring schools. So the parents and teachers know there is the last safety net for them. So I think for all these control measures, we have finally decided to reopen the school. And as we know now, there isn't a big community outbreak on the campus, even though there are occasional cases. So I'm happy to share it with you.
And as you mentioned also before in your presentation, it was the communication with the public from the central government and local governments that also helps. The openness, good news, bad news, complete openness, and that's how you gain trust. And then eventually people would follow your guidelines. Another quick question, I was wondering, like, how is the situation with testing? How do you do like COVID testing? And do you think, from your experience, mass testing is necessary or helpful or beneficial?
Again, our experience works only in Taiwan. So we have not had a general testing in our population. And we are an island. So what we request from the local government to the central government is, if we are not doing a domestic general testing, we should do a general testing at the borders. Why? Because from the local government's standpoint of view, it's the best to, during the reopening phases, of course, in Taiwan, there isn't a reopening phases, but I mean, economy has suffered greatly. So, and Taiwan is highly dependent on international trade. So, and we need to learn the new way of co-living with the virus. Simply by stopping them at the borders is good during the emergency period of time. But we should really think about when we're reopening the borders, when we need to learn the new normal way of living. The border general screening for all the international visitors to Taiwan could be something that's very helpful for the next phase of co-living with the virus.
And I think what was also interesting, you alluded to that, is the huge collaboration between the central government and local governments. And I believe you also mentioned this in one of our conversations, that local governments were working on implementing the guidelines of the central government, but at the same time, we're giving advice and changes to the guidelines based on the local experiences, which is very unusual, like I think not like in the US. The local government would adjust guidelines depending on the local situation. If you can maybe like briefly tell us a couple of examples of that.
So the New Taipei City has 4 million population, and our position is strategically located between the international airport and our capital, Taipei. So our capital, Taipei, has more than 2 million population, and our nearby, combining all the population in this region, we have close to 10 million population. And our borders are all open. You can't stop one person traveling from one city to another. So the virus will travel within this region. And a lot of people commute between work and life, between different cities in the northern part of Taiwan. So what a local government, and especially New Taipei City, is doing is that we started the regional mayor's meeting even before the central government asked us to do. So New Taipei, that's where I work, and Taipei City Mayor, 2 mayors has met to discuss their sharing of medical resources. So that's one thing, what we did ahead of the central government. And we also advise the central government for wearing a mask campaign. That was roughly 2 weeks before the central government starts to make decisions. All this collaboration and this healthy competition is because 2 governments have to play different roles. The central government has their concerns overall on a nationwide scale. And for the local government, our daily job is to listen to people, to check on all these policies issued by the central government if they are implementable. And we need to voice these concerns to the central government. For example, when the central government issue a bailout package to low-income families, they have not set any specific requirements what means a low-income family. So the local government like us, we need to help the central government to set up the guidelines that what do you mean by a low-income family. For example, they have issued a very general term like no stable income. Therefore, no stable income means they cannot provide with their employment certificate. So local government, in order to help their citizens in the widest range possible, we need to help the central government to set up maybe most flexible guidelines or less flexible guidelines. So in a way, we are the first frontline government that are closest to people's life. We see them every day. So we have our role, we have our job. We need to tell the central government. Maybe sometimes they need to do certain policy a little bit earlier on, or they need to push it back. So I think that's that. But we are working on the same goal.
I understand. I think I have the last question, and then we'll open it to the audience, because we can talk forever, but I'm sure our audience has very specific questions and areas they're interested in. My last question would be, do you think that sort of Taiwan's pandemic strategy or know-how can be successfully replicated in bigger countries? And I'm sure you mentioned already about international cooperation, so probably you are advising some countries or cities on your know-how. Do you think it can be implemented in bigger countries?
I do think so. It is more important now than ever to collaborate. By replicating the successful model means that we are learning from each other for the best practices. It may not be 100% replication, but they are always an essential part that we can help each other. For example, some of our guidelines and policy, that how we turn the science into policy that are implementable in a crowded island like Taiwan, could serve as a good example for other cities that are very urban, that depends a lot on public transportation. So all this information can help each other with informing a sound policy that are implementable. Especially, I think, in Taiwan, because we've never experienced lockdowns. We have a huge Bible of all kinds of guidelines that you can think of. For outdoor assembly, more than 1,000 people, outdoor assembly, less than 1,000 people, indoor assembly, how do you seat each other, for restaurants, for bars. So we have a Bible of guidelines because we haven't experienced any lockdowns. So all these guidelines have been really practiced in real life by real people, in real families, in real campuses. So we're happy to share all these guidelines with everyone. And at the same time, even though a lot of people say Taiwan is a successful case, but we don't think so. We think we are still, we need to be very cautious because it's not over yet. There may be second wave. We're still lucky. We don't see a surge number in confirmed and deaths in the second wave, but virus knows no borders. So while sharing information, for example, today, I'm also looking forward to hear from you and bring your information, your experience, your concern, and your expertise to my government and to my society.
Thank you. And so we'll just jump over to the audience, and I'm sure you will provide us even with more interesting information.
Great. Thank you so much, both of you, for starting that conversation. My name is Miyako. I'm the admin for ColumbiaDC's club. All of our wonderful attendees, if you have questions, you can go ahead and just type them into the Q&A box, and then we will collect them and then read them. But if you want to type in your questions, great. Okay, so I see a couple are coming in. So the first one that we have is from Jeff Mishler, and he says that the precautions and all of the procedures that are being taken is very impressive, but he's wondering how it works in terms of funding the activities. Is it really expensive, and how does the government afford, you know, the special taxis, the hotel for quarantine, all of the contact tracers, and all of that? So if you could talk about that a little bit.
Thank you, Jeff. We need to use technology. We need to match resources to control measures. If not, it will be a short time. It will be for a long time. So the government is only setting up the guidelines, and a lot of the control measures can be implemented collaborating with private sectors, and we could match resources. So I'll give two examples. One is about innovation and technology. For the quarantine hotels, New Taipei City has teamed up with a blockchain company. So they help us to set up a matching website for all these people who want to travel back home to Taiwan. They could use this website to match what they need in the hotels, the locations and everything. So people can already start all their planning in before they enter Taiwan. So that's one thing, use innovation and technology and matching your resources with the private sector. One of the industry that were hit the hardest is the tourism industry. So our city government also collaborated with them. Some of the hotels are happy to provide their rooms that are not being used otherwise at a really, really relatively cheap prices, highly discounted price, because they only need, if they want to maintain a certain business, they need to collaborate with us. So and also for city government, when we collaborate with them, we always take one step further for to think about together for their future business. So we did not disclose the names of that hotel. We only disclose the photos of their interior rooms, also the location, the rough location of their hotels. So in this way, we were able to have 2,000 heavily discounted rate hotel rooms for all the citizens that are in need of quarantine hotel. Taxi services are the same. They do not have enough. They do not have enough business, so the city government provides them with all the sanitation needs, and they are happy to run these special routes for the government. So I think collaboration and use innovation technology.
Great. Our next question is from James Figatakis, and he says that he studied in both Taiwan and in China, as well as living and working in Hong Kong. And he says that you've spoken about the excellent government leadership and response together with the scientific community, but can you talk a little bit about how the Taiwanese culture and the people contributed to this from the ground up, and what values in Taiwan contributed to the successes that you've seen?
Taiwan and China now have very different governing system, lifestyles and cultures. For example, one of the most important thing is that when we are having dinners, it's a round table. People sit around a round table and share dishes. This is a perfect environment for spreading virus, the best way you can think of. So in Taiwan and in China, we share this very highly similar culture, but we deal with it very differently. I think it has to do with the governing system. So in Taiwan, all the elected officials know that the best way to counter misinformation is from the government to give them the right information in a package easy to be understood, so they will not receive misinformation from other untrustworthy sources. For this, we've known along the way. So after the daily briefing of the central government, our city government would also have a daily briefing to the citizens that are concerned. So how do we translate local policy? How does it affect when you take on the city bus? Do you their home? What do you need to do? What form you are giving in our social media? Well, in Taiwan, the most popular social media is Facebook. We make easy to be understood, funny graphics, make sure this information is easy to digest. So I think when the government, people always want information. It really depends on if the government is willing to have an open communication and learn a little bit from the private sector, package, market your right information well. Then I think the citizens, when they receive the right information, they would appreciate it, and it's easier for them to follow the guidelines set by the government.
Great, and we are facing a little bit of buffering, so thank you everyone for staying with us. We have a question from Katerina Slobodova, and she's from TC, which I think is the Teachers College, and she says that she's fascinated by the efficiency of implementation of your COVID-19 prevention measures, especially because there's so much debate in the US about which decisions should be made by the government versus private citizens, especially when it comes to private businesses, which includes private schools. So if you could talk a little bit about what the government's decision was, the decision-making process with regards to the scope of policies, and did you face any pushbacks from private organizations?
It's a big question, and I'm so happy to hear from you, Katerina. It's been a while that she was a CAA Taiwan volunteer for a long time when she was studying in Taiwan. It's a big question. It's a good question. That's why I say all the policies, if you want it to be implemented, if you're serious about it, it needs to be wholesome. You need to look at if your citizens are ready for this policy, if you have provided enough support for them, if they really want to implement the policy. If they do want to wear a mask, but there's nowhere to buy a mask, how do they do it? So this virus hits all countries, and every country runs in a very different way. So as a CPA alumna, if I can say very quickly that this comparison could help us to understand that when you have a science, when the science gives you, tells you exactly what you need to do, why it is so difficult to turn it into policy, because you really need to look at the society, how best for them to accept and to implement and follow the policies. You need to think about your political system. You need to think about your religious system. You need to think about if the society is made decisions collectively or individually. You also need to think about if it's a highly urbanized society or it's not the urbanized society. How do they travel to work? So I think there's one thing very lucky is in Taiwan, we have a highest level emergency command center to set up. Actually, New Taipei is the first city government to set up highest level of emergency meeting. In this meeting, it's not just health departments. All 29 departments are present there to give our voice, to give our concern. And that would be very helpful in making decision on the trade-offs between different policy, on the timing. When do you start the policy? When do you start examining it? It needs to be a rolling basis. Health department always has the final say, but before they have the final say, they need to listen to all the concerns. It takes time. It takes time. So that is also helpful because for the US, if you need to work remotely, maybe you do not have this opportunity to have face-to-face communication. And sometimes a lot of communication get lost during the remote working environment. I'm not giving an answer, but I hope that somehow tells you my thought.
Yes, thank you so much. We have a few questions where I think we're really interested as Americans in trying to see what successes from the Taiwan's approach that could be in the US. So Katrina Becker says that Taiwan's government coordinated and handled, how did you coordinate and handle the additional strain on the national medical system? And how did the national healthcare offer advantages and disadvantages over privatized healthcare?
We have a quality public health system, and to get access to this system, there is a health card. We also have an identification card. So I think health system and personal ID are two keys, two bedrocks in our success. So you need to ask your society if there is a general good quality health system. Do they want to be tracked by an ID numbers? Because without these two, it's really difficult to know where are these people, how the virus travels, which area now has the highest confirmed cases, and how do we, the most important thing is how do we make sure we are treating our nationals, we're treating people, but at the same time, the medical system is not collapsing. So all the system needs to go hand in hand. The US we need to collaborate with international society. I mentioned that, and I stress that again, because you don't know how much we envy the US. You may think that we're doing it well, but to have vaccines, to have a good vaccine that are accessible and low price or affordable price to everyone, we can only count on countries like the US, Japan, EU, who has the most advanced technology and labs to develop vaccines. We know we need to co-live with the virus. And how do we co-live with the virus? General testing and vaccines are both very important. In Taiwan, even though we have a very advanced biotechnologies, but to developing vaccine, all of you know, only in a few handful of countries. So for that, we need collaborations. So you still have a lot of resources, assets. It's really something that we envy. We're jealous about that.
We have another question from Lindsay Lim, a little bit more specific and detailed. She says, for people who don't have access or don't know how to use online financial services, if they're quarantined, how do you get food delivered to your homes, especially with so many people needing to quarantine? Or is it just that because everybody did at the beginning that you are able to go out more now?
For New Taipei City, especially for those citizens that need home quarantines, so far for the past 6 months in our city, out of 4 million population, we have about more than 40,000 people that have been home quarantines. So this is a great question, because this is something local governments need to provide solutions, because if they cannot get food, they will want to run away. They will need to go somewhere to get food, and then you cannot implement the policy. So this is a perfect question, how the central government issue a policy and how local governments provide solutions. We have, in our city, we have 1,000 village chiefs, and they have been carrying out a lot of missions that Uber Eats needs to do, but don't want to do, because for these people who are quarantined in the beginning, I think now they're okay. They have developed, Uber Eats has developed a standard procedure that they keep the food outside, and people could come out and pick up the food, things like that. But in the beginning, all these village chiefs are responsible for two things: taking care of their food, taking care of their garbages. So they need to visit them. And the city government provides all the PPE to protect our village chiefs. So they will call, they will make sure what kind of food they need. And it's not just the people who are staying home for home quarantine, but also these senior people that usually depend heavily on people who deliver them food. So for our biggest district, the village chiefs need a lot of assistance for PPE, as well as to give them more personnel at that time. So the government take care of all the, provide all the solution in the beginning. And then later on, as I say, using technology, matching resources with private sector. Then later on, when the government has already set up a very safe policy, the private sectors then will learn, for example, Uber Eats, they will also protect themselves with proper gear. So very soon they picked up.
Great, and another question, really great graphics that you shared with us earlier, so thank you for that. There was a flow chart at the beginning which showed the criteria for determining who needed to quarantine. I don't know if we could show that again, or if you could just talk through how you know whether you needed to quarantine.
Sure. So if I can ask Kambis to give me the authority to share screen, then I can put it back. So the flow chart is a border control procedure. We put that into an easy to be understand form. During March to June, we have banned all the travelers. Starting in late June, so between March and June, only nationals can return home. So international travelers are banned. Starting from late June, we have started accepting certain international visitors for business purposes from low-risk countries. The central government, the CECC, the Central Epidemic Control Center, they would give us the country list. So which countries are to high risk, certain countries are low to mid risk. So some can come to Taiwan, some cannot, some can apply. But this is a procedure. Anyone that fulfill the criteria and can enter will face this procedure. So first you come into the airport, you fill up the form so we know if you are from the countries of high risk. Then you will be measured the temperature. If you are 37.5 degrees higher and above, then you will be sent to hospital. This will be, the transportation will be provided by the hospital. And if you are sent to the hospitals that are located in New Taipei City, then we'll start, our city government and our local health department will receive your information. So that's the first, the worst case scenario. But if you have high fever and you are not hospitalized, you will be sent to the centralized quarantine centers. There are 3 such centers in New Taipei cities, and we'll also receive your information. But most of the people who have shown no symptoms once they enter the airport, they will be taking special quarantine taxis with all the proper protections, protecting the driver and protecting the passengers. Also, this taxi will not stop any additional stops. It's taking you from point A, that's the airport, to point B. The point B is very possible to be your home in Taiwan or a quarantine hotels that you already match yourself with before you took the flight. As I mentioned earlier, that we have an online metrophone if you are in New Taipei City. And if you haven't done you haven't had a quarantine hotel at the airport every day, we have reserved enough hotel beds for people who haven't made the online reservation. And then this is just the very simple chart. After this chart, once you get into quarantine hotels or home quarantines, you'll receive the phone calls from our village chiefs. And then if you are not staying home or you're not staying in the quarantine hotels, you will not just receive phone calls from the village chiefs. The policemen will come to make sure that you're staying at where you are. And you may experience a very, very high fine, as high as $30,000 US.
All right, so we have just a few seconds left, but I got a couple of questions here that I think a lot of people in the US feel. So we have Dr. Diane Deitel and Judith Molinelli. And Judith says she's really discouraged just because, you know, we don't have a coherent national plan in the US, and there's misinformation, data's being diverted from hospitals to the administration. We're seeing increased suicide rates. Older people are isolated. The college kids aren't able to go back to campus. So I feel like a lot of people in the US just feeling really discouraged about our country's response. And if you just have any lasting thoughts on maybe some things that we can take away, we can't change the direction the government is taking, but what can we do on a local level to help our communities be safer and healthier?
Thank you, Diane. It's a, as a CPA alumna, this is something I deeply, deeply concerned about for the younger generation. In our government, we also have the first year of civil servants coming into our government, and we call them COVID generation. And these young people has given me so much support. Why? Because they are so techie savvy. They know how to make a funny video that could attract attention and be informational as well, educational as well. So during the past few months, I actually been supported greatly. Our work has been supported greatly by this COVID generation civil servant who just entered the civil service track. Because for the past few weeks, Google Drives have replaced flight tickets, and webinars has replaced all of our international meetings. Without them, I don't know how I could conduct my international collaboration. So I really feel deeply with Diane. Young people, they actually are the best support, the best help we could use during the pandemics, because remote working, technology, they were born with these skills, but why didn't we utilize them? Why couldn't we give them more hope during this period? We, these people in this position, we need to think about that and give them more platform. Give some of your regular jobs or your regular procurement, try to turn some of the traditional meeting into webinars and give them the opportunity. So inclusiveness is also another thing we learned. Human rights have been violated. Actually, one of my classmates were actually detained in China, Michael Kovrig, and it has a lot to do with COVID-19 as well. And we've seen rising numbers of domestic violence as well. So you can see I'm wearing a pin of Sustainable Development Goals. We really need to think about what this virus has taught us. Economies has seen a setback. Society has seen a setback, but the environment has had a rare moment to breathe. So we need to think of a more wholesome approach after COVID-19. First is empower our young people. They have the potential, they have the skills, give them the voice, make them speak. When I have the opportunities to speak, maybe I should also invite my young colleagues to speak as well. We are going to have a webinar that's set up by my young colleagues in a few weeks' time. So all this, give power to them, empower young generation. They will give you far more you can imagine, and try to think about sustainability after COVID-19. Can we sustain our economic growth? Can we not harm the environment so much? Can we rethink how to co-live with the virus, and how technology can help us to move on to the next lifestyle? So all this, Diane, I know I didn't answer you, but my thoughts are with you.
Well, Director General Chingyu Yao, thanks so much for waking up this early and educating us. And thanks, Natasha, for doing a great interview. Loved it. The clip of the recording of this would be posted in about 24 hours, and we'll send an email to everyone with the link. If nobody has any comments, thank you so much. Best of luck for your win and continued success in keeping people safe.
Thank you, Ching.
I want to thank Kambiz, I want to thank Natasha. I'm so grateful that I can share my experience working in the government as a CIPA alumna. And one last thing is that I believe many, many SIPA alumni are working around the world to shape policy that are COVID-19 related. I want to use this platform to thank you, and we should connect with each other and we should inspire each other, because what we do is really, really important. And thank you, Kambiz, for all the support that you give me.
Thank you so much. All right. Bye. Bye, everyone.
Thank you.